My name is Kendra O'Donnell and Northland Health Centre, and I'm a staff nurse here, working in treatment rooms, seeing a variety of different patients with different issues and problems. So there's a big selection of different treatments we offer. So obviously we take bloods, which our phlebotomists do. We administer different injections. We treat the biggest bulk of our work is wound care, all sorts of different things really. I joined treatment room 2 years ago, July coming, and I think Gail, our band 7, came about a month before we did, and we noticed that there perhaps was not a lacking, but perhaps we could have improved in that area, you know. In comparison to the work I was doing back home, I could see that we needed to maybe improve and sort of take care of legs in a different way. So I was Doppler trained back home, so slowly with help of the staff and Gail, we decided that we would start Dopplering patients much sooner. So the literature says that to treat leg ulcers in an effective way, that they should be Dopplered within 2 weeks of no improvement of a leg ulceration. So we took that on board and started to make processes where we could make that happen. And slowly we were able to sort of start seeing people much quicker, Doppling them much quicker, getting them in more appropriate treatment, which led to more healing. Basically it's a machine, and we use that to assess the blood flow or to rule out arterial disease basically. So it gives us a reading, and there's a sort of a safe reading where you know that you can put that compression on, and there's readings outside of that safe reading which tells you that it possibly is not appropriate. So we have to do that test first to determine what the way forward is for that patient. So providing those results come in a certain boundary, we can then look at that person as an individual and look at the results. It's an holistic assessment as well as many questions asked about their health, their lifestyle. That with the result of the actual figures we get, we can make a decision about the plan of care. So that means at that appointment, if they're suitable for compression, we can decide what compression to put them in and put them in that day. That's the gold standard in terms of leg ulceration. So an ulceration is classed as a normal leg wound that's sort of there for any reason. It could be due to a trauma, could be for lots of reasons, spontaneous ulceration, and that's the preferred way with nice guidelines. There's lots of literature now suggesting this is the way forward, the scientific way forward. So just following those guidelines really, to improve the care we give. So once we've done a Doppler test, we've asked all the questions, we've got the readings, and we also realise that it's falling out of the safe reading zone, we would then consider the results, consider what reason it is, and then we would possibly, if we felt necessary and that we did feel it was more arterial, what I would do then is refer to the GP. So I would type an email up, tell him my findings, tell him that I think it would be appropriate for this person to be referred to vascular for a more in-depth test, and then 9 times out of 10 the GP would then refer to vascular. Because if you looked possibly at a leg with an ulceration, just from my experience, that isn't being treated in that way, and it's a venous problem, so they should possibly be having the compression, and for whatever reason they've not, that person could be coming for months and months and months because the circulation is compromised, so that wound is not getting a good blood flow that it needs to heal. So from the person's perspective, it's quite life impacting. Because they've got this painful sore which often leaks, quite debilitating. You've got them coming back 2 or 3 times a week, sometimes daily if it's really leaky. So you have that situation. The cost to the patients, often these patients are frail and old, so they're having to get taxis because they don't drive. So there's lots of implications, like mentally, and they're changing their lifestyle. They don't go out to meet their friends anymore. More prone to getting infections with an ulceration that's been there a long time. You're able to make an assessment on the day. If they're suitable for the compression, you can put the compression on the day, and then you can gradually see an improvement in that leg. So what would happen once we've healed the leg also with a compression bandage, we wouldn't just discharge them in terms of that's the treatment done, because it's a venous problem, because it's veins, the veins as we age don't function effectively, so the valves don't work. So they still need a stocking to actually make those valves push back together and work and get the venous blood flow back and the return. So we would then measure them for stockings, keep them in the bandages until the stockings arrive, and then bring them back to the appointment and put them in the stocking. And then we would probably bring them back a week later to make sure everything was comfortable and manageable for them, and then we would discharge them.
Hi, my name's Claire Ray. I'm Interim Head of Health and Social Care here in the South Partnership. Delighted to hear that the Rutherglen treatment rooms have got the big shout out, and just a huge thanks for all the efforts and all the work that you do in the treatment rooms and how you provide for the people of Rutherglen. It's very much appreciated in challenging times that we face. So thank you.